Hi, I'm Liz. I was diagnosed with pulmonary hypertension 8 years ago, and about a year ago, one of the medications that I was put on is called Remodulin IV. Now, the medication Remodulin can be also delivered to your body through subcutaneous form, which I was on for about 8 months, but now for a year now, I've been on Remodulin, but the IV form. The IV form is when they put a catheter, it's a tunneled catheter that goes into your vein, into your heart, and it delivers the medication that way 24/7 via a pump like this one. This is called a CAD Legacy 1, and the medication cartridge is right here. It's pretty hard to see, but it's like a little bag filled with 100 mLs of medication. Every patient is different as far as how much milliliters of Remodulin they use. It depends on your rate or dosage that you're on. And then it is mixed with a liquid. It can be sterile saline, where you would need to mix it every time that you're going to change it, I think. I don't remember. Or in my case, my Remodulin milliliters is mixed in here with Flolan diluent. So when I mix that together and I put it into this cartridge, it is good for 2 weeks. So usually what I do is every 2 weeks I mix 7 cartridges, and these cartridges I change on myself every 2 days. So 1 cartridge of medication lasts 48 hours. So today is my day to change this cartridge because we're almost out. The indicator here is telling me that I have 14.4 milliliters left. So I'm going to change this cartridge and put a new one back in. Again, 100 mLs is what fits in this cartridge. And I've had a lot of people ask me what it's like or what happens when you do a dressing change, if it's too difficult, if it's a lot. They're stressed about going into an IV medication. So I just wanted to kind of make this video to ease their concerns, anybody that is going to be going under Remodulin IV, so you can kind of know what it entails. So we start off first by washing our hands, in which I already did. I also have a room in my home that is just dedicated for these type of things. I don't let my dog in here. It's a very clean room. In the closet behind me is where I keep all of my supplies that I get every month. So UPS or FedEx delivers a big, huge box of all of the supplies. And for a dressing change, I'm going to tell you all the supplies that I use. I usually try to make these packs. So this pack is for a dressing change / cartridge change because I do clean this area when I change the cartridge as well. So what I use is a mask. You'll need a mask because anytime you take this dressing off, it's exposed to the air, so you want to wear a mask. And if you have a caregiver that helps you do your dressing change, they need to also wear a mask. Exam gloves, these don't need to be sterile. I use these just to remove this tape. I buy my own dressing, which is just a simple Band-Aid, but it's the large one. And they are waterproof, and they are sterile, as you can see right there. It says that they are sterile. I've noticed with my skin, I get very sensitive, so I have found that this is what works best for me. I'm going to show you some of the dressings that Accredo or your provider will send. They will send these famous ones, IV 3000, and I tried these. They were fine when I used them for Remodulin subcutaneous, but here, for some reason, they just didn't work. They really, after a while of using these, they irritated my skin. They might also send you these Tegaderm. Now this is a nice big size. But after a while, again, my skin started getting irritated, so I couldn't use this. And this is clear, and this is also clear. Another one, here's Primapore, and you can see it has like a little gauze in the middle. Because it has that gauze in the middle and you are not able to see it, you have to change this dressing every day or every 2 days. And with these, because they're clear, you can leave these on for 7 days. And here's another one, Medipore Pad. And it's pretty big. But this one also has, I don't know if you can see, a little pad underneath, like a little 4x4 gauze. So when it's, anytime your site exit is covered and you can't see, then you need to change it every 24 to 48 hours. So anyways, those are some of the ones that they use, but I like this, simple, and I get them at Walmart at a lower cost. Okay, so that. Oh, and they also might send you these. This is an actual dressing kit, a dressing change. It says tray, but it's not a tray, it's a kit. And I can show you what's in here. What's in here, and as I open this, all the contents inside are sterile, they're clean. So you would put sterile gloves and then grab this. Or you grab your mask, put it on. Keep that for later. There's sterile gloves. So you would put this on the side. Let me show you. Put it on the side somewhere, and then you would put these gloves on. And the way you do that, I'll just show you. You have to use aseptic or sterile technique. And the reason that I'm pretty good at this is because for almost 20 years I've worked in the operating room. So you grab, So you grab one and you guide your fingers through, and then you grab the other one, open up the little hole there. And there you go. Sterile hands. Now I can touch everything in here. But I'm just showing you. So it also has a tray. So you'd open this up. And now you have a sterile area. It has tape so that you can measure to see if your line has come out or not. I don't really use this. It comes with swab sticks. This one is alcohol, and this one is ChloraPrep. Now, this is what you're supposed to use to clean your skin after taking off that bandage, but my skin started getting really irritated, so I do not use these anymore. But this is what they want you to use. There's also a skin barrier wipe. There's some gauze. This piece, little Telfa pad, and more gauze. They also have some steri strips, and then they have the dressing, which is pretty big. And again, I used to use this, but it irritated my skin a lot, so I stopped using it. So anyways, that's what is in the dressing kit change. Okay, so I'm going to show you how I do this. So this is the one that I have connected to me right now. Usually goes underneath my clothes or my shirt. And I carry a fanny pack on my waist, and then I put this in there. I'm going to go ahead and put this mask on. And we're going to clean with some alcohol my table or my little tray here, it never hurts to clean your area in a circular motion from the inside to the outside. Okay, now I'm going to put my exam gloves. Now these aren't sterile. We've been touching them. They do not come packaged sterile. So they are not sterile, but it's good too. They're clean. So I'm going to grab an alcohol pad and I just kind of clean the line because it's been on my body. It's been underneath the clothes, touched my clothes and everything. There might be, things on it. So I just go ahead and clean that. And then I'll use another one to just kind of clean my skin just lightly all around. And that's all I use to clean my skin. In my area here, I also have a mirror, a lighted mirror, so it helps me so I can get really close and look at my exit site just to make sure that everything is nice and clean. So, all right, I'm gonna take this off, and it's just, all I put was one little gauze, and this is the Band-Aid. Okay. It's thrown away, and you'll see how my line is wrapped with gauze. I do that because just to prevent my skin from getting irritated from constantly rubbing on this tube or line or catheter, whatever you want to call it. And now I'll get another alcohol wipe and just kind of wipe around it. And I'm looking at the exit site, just making sure it's nice and clean. Making sure there's no drainage. And I'm cleaning, or I'm wiping lightly, just in a circular motion from the inside to the out. And again, I'm going to just wipe the tube. Okay, good. So that looks good. Nice and clean. There's no drainage, no pus, no signs of infection. So I'm going to take these gloves off, and while my skin is breathing from being under that bandage for 2 days or 48 hours, I'm going to get my next cartridge ready. So what I will need for that is the extension tubing. This is the tubing that is connected to the end of my line. And once a week, so I just do it on weekends, you will change your Q site. So today I'm not going to be changing this, but I just wanted to let you know that these are changed every weekend. And also your pump uses batteries in here. It uses 2 AA batteries. So on weekends, that's when I change the batteries on both my pumps. You will have 2 pumps, one that's on you and the extra. Okay, and another item that a lot of people use, or your nurse will probably tell you, is a bio patch. They place a bio patch right there, which I do not use anymore because it was irritating my skin. But I wanted to show you this bio patch just so that you can see. So you should definitely use it. Follow the instructions of your nurse because you might not be like me where you have problems with your skin. You might be totally fine and you're able to use this and the dressings that they provide you. But if not, if you're like me and your skin is very sensitive, I hope that my little pieces of advice will help you. They're just tips. Okay, so I will need this, and I will need my extra pump, and I will need my cartridge, my next cartridge, which I mixed, it says here on the date, on the 4th. And this paper tells you everything. How many mLs of Remodulin there is, how many mLs of Flolan diluent I used. I write an expiration date on there so that I know, because like I said, it's only good for 2 weeks once it's mixed. So I write the dosage, the pump rate, and it's good for 48 hours, and obviously your name. Okay, so now this is a little key to take off the duster or whatever it's called. Do that. So that comes off, and you put your new one. Okay. And now the tube just goes in here. Okay, so now the cartridge is in place. So now I will turn it on by pressing the on-off. Press and hold. I pressed it and I'm holding. There we go. So it's now it's going to start up. You'll see. It goes through its little checkoff list. So now it's ready, and it says stopped. So now what we will do is this end will get connected to your tubing. So here's my tube. Trash. And what I do is I wipe. You're going to be using a lot of alcohol prep pads. So I clean before I take the red cap off and after. And then the way I know that I cleaned it enough is I say the ABCs in my head once, and then I know I've cleaned enough. And this will go connected to the blue tip. Okay, so now I'm going to take off the red, and I'm going to wipe here. Okay, and now the blue tip will get connected. Let's take this off. And that's it. Now it's connected. This goes in the trash. So here is the tube. This part, a good way to remember which end is to connect it is this part goes closer to you. Okay? So now what we need to do is prime this tubing. So on the pump, I'm going to press and hold the prime button. Let go, and now it's ready to prime. So now the fluid is going through the tube and it's priming it. Once it reaches the tip that I can see a little bit come out, then I will let it go and stop the priming process. Usually when it gets up to here, it stops. So I gotta let go and push and hold again. Okay, it's almost there. There we go. So now my tubing is all primed there. And yes, okay, good. So now on the line that I have connected to me, first thing I'm going to get my current pump and I'm going to press the stop start button because you see how it says it's run? That means it's running. So I'm going to stop it before I take this tube off. So press and hold to stop. Now it says stopped. So now it is safe to clamp this. It's clamped. And then now I will disconnect this tube. When I disconnect it, I'm going to wipe it with an alcohol pad. So let's take that off. Before I throw it away, I put the cap on it. I don't know, just for whatever. If it's on the trash can, I just do that. So now I'm going to wipe this end. Never do my fingers touch the tip of the tube. It's only the alcohol wipe that is touching it. Okay, so that is clean. Now I'm going to remove this cap and connect my new line. And there it is. We can unclamp this. And I'm connected to the new pump. So now we want to start this. So we will press stop start button, press and hold. And there we go. It's going to go through its motions, rate, how much given, 0. Okay, now it says run. That means that it is running. And there's 98.4 milliliters. Remember, it starts off at 100 milliliters, but we primed the tubing. So I guess it used 0.6 or whatever. So that's why the number is not 100 mLs. It's a little bit less because the fluid is in, or the medication is in the tube. So we're done there. And what I like to do is, you see this little thingamajig? I let it fall all the way here, and I put a piece of tape on the end. And the reason that I do this is so that the tube won't fall all the way, get caught under my bra or my shirt or whatever. So that little thingamajig just stays right here. See? But if I need to, I can always pull it down. So that is done there. Now I will get this old one and I'm going to clear it. So I'm going to press next. See how it says there was 13.8 in it? I'm going to clear that. So I'm going to press clear and enter to save it. Next. It says pump rate of 46. I'm going to leave that there. So I'm going to press next. And it says how much was given. I'm going to clear that to 0 and enter to save it. Now I'm going to press next, next, next. And there we go. We want it to be at the stopped. And now I can turn it off. If I was going to change the batteries, I would change the batteries right there. So now I'm going to press and hold the on-off button. And now it's off. Now I can take this off, and this will go into the trash. Now I can put my dust keeper or whatever it's called put that on there and put my little key on there. So whenever I go places like long road trips, or even if I'm gonna drive like 50 miles away from home, I always carry my extra pump and extra little medications and stuff in the car with me. So that's where that will go. And this was the old one. And this will go in the trash. So this is my new one. All right, so now I'm gonna clean this through my dressing clean. So, like I said, we have the Band-Aid that I use, and I use to clean it, to wipe, 2x2 gauze. They're really small. I use 3 of them. I wipe with 2, and then I use 2 for underneath the bandage. And I use just regular old saline or sodium chloride. Now this is not sterile, so it's okay if I touch that. So we have that, and then I have my sterile gloves. In my case, they're a size small, and my sterile drape to create my sterile area. Okay, so the first thing I'm gonna do is open my sterile drape. So carefully, I try only to touch the corners. Only the corners. So there we go. This is my sterile area. Now the gloves do not have to stay in the sterile area because I'm going to put them on. I just kind of put this plastic underneath my drape. Now I'm going to open up my things without touching. There's the first 4x4 gauze. Second. And third. And then I'm going to open up my sterile Band-Aid. There we go. And take out the bubbles. Okay. I am only going to let wet 2 of these because that's all I use. Okay. The rest is trash. Now I'm going to put on my sterile gloves. Make sure my hair's out of the way. One. 2. All right, 2 sterile hands. Now I'm not going to touch anything. I'm not going to touch my mask. I'm not going to touch because I want to keep my hands sterile. So now what I'm going to do is start wiping my skin. This is one of the wet ones. And we will go in a circular motion from the inside out. Now really my skin is not sterile, so technically this is not a sterile procedure, but it's as clean as it will get. So that's all I use to clean my skin is sterile saline. Just pretty much salt water is what it is. I don't use all those alcohol and chloroprep or none of that because from doing that so much, so often, it just ended up irritating my skin and I'd get blisters and everything. So we figured out that this is the best thing for me. So right now I'm just letting my skin kind of dry because it was wet. And my skin looks good. Some people I know might get grossed out by this. Sensitive stomach people. So one of the packs has two 4x4s. So 4x4s, 2x2s. So I'm going to use one to wrap around this line so that it's not constantly rubbing on my skin. So let me show you. So that's what I do. Nice and neat. Now I'm not pulling on my line much. I'm being very gentle. Now some people leave it going down. I noticed that this area, the skin area, is a lot more sensitive. So I stopped doing that and now I go up. Because my shoulder skin just seems to tolerate this better. Okay, I'm gonna get the second one and fold it in half because I don't need it so big. Now I'm gonna cover that. And now I will put my Band-Aid. Ooh, slipped. Put my Band-Aid. And I try to change it up every time I put a new Band-Aid so that it's not always, the sticky part is not always on the same area. Voila! Nice and covered. And then I'll so now that my dressing is covered, I can take off my mask, I can take off these gloves, trash, I can breathe. So that's covered. All of that is trash. Okay, so now what I like to do is instead of leaving this hanging like that, I'll tape it down. Now if you need help, you can have your caregiver, in my case my husband, help you putting the tape on, because it is kind of hard to do it on your own. I messed up. I don't like that. I like it to be nice and smooth. Okay, so I just kind of like to loop it around the line or the tube because I don't want to just tape it down because then the tube will be touching my skin and I might get prone, that my skin is prone to being sensitive. So this way I loop it around so the tube is never really rubbing on my skin. And then this tube I'll just put in here, put everything in there so that it's not hanging outside. It'll be hanging under my clothes. I guess I can do that right now. So we will guide it through. Okay. So there we go. It's under my shirt. And for the most part, you can't even see it. So there you have it. I hope that helped. I hope that helps and keep you at ease. This is very easy compared to other medications. I was also on Dimitri, and that was a whole nother story. But all right, so I hope this was useful for you. Thanks for watching. Bye.